Hi, it's been quite some time since I made my last video, obviously. That's for kind of a number of different reasons. To I wanted to make a few videos. I actually made one video um, about like clothing and stuff like that, but the lighting wasn't very good. And so I planned to do it later, and then I just kind of kept putting it off, and then the next thing I know, it's been like almost 2 months or so, and I haven't made a video, so it's time that I make a video. Today I wanted to talk specifically about sort of the trans healthcare system in Holland. I didn't know that much about it when I first came here, but I had heard that it was fairly good. I suppose maybe that's true in relatively speaking in comparison to other countries, but it's still not very good in my opinion. I guess I'll just kind of go through what the procedure is to get healthcare as a trans person in Holland. Specifically, get transgender-related healthcare, so hormone therapy, surgery, and even voice training, apparently. So the initial step is, I think it's a 3 to 6 month waiting list to go to the gender team in Amsterdam. And that place has 2 appointments that you need. One is an appointment with a doctor and another appointment with a psychologist. So I did that, of course, and I was under the impression that once that was over, then you would get to start the evaluation process or something like that, but I actually just did my appointment for that today. I finished my second appointment. The first one was with the doctor, and then a couple of weeks later it was with the psychologist. And then they put you on another 6-month waiting list to get onto evaluation from a psychologist. Now, this doesn't matter that I was confirmed as having gender dysphoria by a psychologist 2 years ago. I've legally changed my gender in Canada, and I've had a Canadian doctor, actually both medical and PhD doctor, who specializes in transsexual studies, also sign that I am transgender. However, that doesn't seem to matter. Regardless of your status as transgender outside of the Netherlands, you have to go through the process anyway. So now I'm on a 6-month waiting list to be evaluated to see whether or not I am transgender, and that process takes between 6 to 12 months, apparently. So in my case, I'm really not exactly sure why, because clearly I am transgender, and I'm not sure what they're going to spend 6 months evaluating. You're supposed to have regular appointments during this time, so yeah, I'm not really sure what the purpose of this is. But in any case, yeah, so I have to wait 6 months, and then I have to wait another 6 to 12 months before I can receive any sort of treatment through my insurance for my transgender stuff. So that would include a tracheal shave for my Adam's apple, voice therapy even, not even voice surgery, voice therapy. I could get voice therapy myself, but I'll have to pay for it. Although they did mention maybe I can get my family doctor to refer me to that so that insurance might cover it. And yeah, so then after you do this with them, after you get confirmed as transgender with them after 6 to 12 months, then there's a 1-year period where they medically observe you and I guess give you hormone replacement therapy. Of course, in my case, I've already been on hormone replacement therapy up till now for more than 2 years. So for me, this is, again, largely pointless. And then after that year, finally, then I guess you get on a waiting list to have surgery, which is who knows how long. So, yeah, I'm very, very disappointed today. I was really excited about what I had heard about like transgender care in the Netherlands. And yeah, it's not so good, seems like. So yeah, I mean, obviously I have to consider about whether or not I want to try and pay for those different surgeries and things that I need myself. But kind of the terrible thing is, though, is that they mandate you to pay for health insurance in this country. So you have to pay for insurance that you can't actually use. And that also then prevents you from saving money to get the things that you need. And to me, it doesn't make any sense, because, like, right now I have, for example, I have therapy for social anxiety. And a big part of my social anxiety is my problems with my voice and my problems with my appearance, like my Adam's apple, for example. And like, so rather that they would rather me wait for like 2 years for this to happen and go to therapy sessions every month or every few weeks, rather than to just pay for it. Like, it's so stupid. I'm really, really frustrated. But yeah, that's what's new for me recently, and but I'm okay, more or less, other than that. And I know that I need to make my 2 years of hormone replacement therapy sort of anniversary video at some point in the near future. I should have done it already, and yeah, I just have to kind of get around to writing all of the different points that I want to talk about out, and then I can make like a half-hour video or something about it. And before I go, I want to congratulate my good friend Colette on having her her SRS. So congratulations, Colette. Okay. Anyway, that's it for now, and hopefully I'll make videos a little bit more frequently again and get back into the rhythm of it. Take care. Bye bye.